My name is Lucy Hilton. I'm a nurse on the Behavioral Health Unit, and I'm here to talk to you about the fall risk assessment. We will be demonstrating the Get Up and Go test, which is one of the key elements of the fall risk assessment here shortly. The first thing you want to do before assessing your patient is you want to use your red rule to identify your patient. You want to look at the name band and identify the patient with the name and birth date. So, Ms. Smith?
Yes.
Could you tell me your full name?
My name is Kathy Smith.
Okay, and what's your birth date?
My birth date is September 14th, 1914.
Great. Okay, that's right. All right. The next thing you want to do is, as you're talking to your patient, you want to get a general idea of their orientation. You want to be looking at confusion, disorientation, and impulsivity for the first category of the fall risk. So we would just be talking naturally, and can you tell me where we are today?
Well, I think I'm outside at a ball game.
Okay. All right. And what's the date today?
It's February 29th.
Okay. So obviously Ms. Smith is disoriented, so she would score 4 in the category. The first category, disorientation, confusion, and impulsivity. The next category you would be looking at is, does the patient suffer from depression? This can be a medical diagnosis of depression, or does the patient exhibit symptoms of depression, withdrawn, dull, flat affect, or not interacting appropriately with patients or peers. The next category would be altered elimination. You would assess your patient's elimination status. Is he or she incontinent? Do they have nocturia, hesitancy, or suffer from problems of frequency? This does not include a Foley catheter. The next category would be dizziness or lightheadedness, and you can simply ask the patient, how do you feel today? Is the room spinning? Do you feel dizzy at all?
No, I feel pretty good today. I'm ready to go to my ball game.
Great. So she would score a 0 in that category. The next category would be gender. Females do not count in this category, but males automatically receive a 1 point in this category. Males tend to want to do things on their own, so they are at increased fall risk because they would not ask staff for assistance. The next category are benzodiazepines. You would assess your patient's MAR to see if the patient has been on these medications within the last 24 hours. The most common medications you may see are Ativan, Xanax, and Klonopin. There are others, and you can refer to the policy for those. The next group of medications you would like to assess are the anti-epileptics. Those would be your Novant, your anti-seizure medications, and mood stabilizers. The last category we're going to assess is the Get Up and Go test. So we're going to do this using our patient, Ms. Smith. All right, Ms. Smith, we're going to do the Get Up and Go test today, okay? This is assessing your ability to get up on your own to find out what fall risk you are at, okay?
All right.
All right. First thing I need you to do is, can you get your feet on the floor for me?
Yes, I
Can you
do
scoot
that.
to the edge of the bed?
Okay.
All right, and put your hands flat on your thighs. Okay, now I'm going to ask you to stand up. If you do not feel like you can safely stand up doing this, then just guide yourself back to the bed, okay? All right, can you try to stand for me? All right, very good, nice and steady. That's wonderful. So you score a 0 because you got up on your first attempt without any help. Okay?
Okay.
All right. If the patient requires multiple attempts to stand up but still is able to do it by herself, she would score 3. If the patient is unable to rise without assistance, it would be a 4. If the patient is able to stand in a single movement without assistance, they score a 0. If they require frequent or multiple attempts to stand, they would score a 3. If the patient is unable to stand on their own, they would score a 4. It's important to remember while doing the fall risk assessment, you should practice with a questioning attitude. You should stop, reflect on the data you're gathering. Does it make sense? If it doesn't, you should resolve those issues. And just remember, always practice with a questioning attitude.